Relapsing polychondritis is a rare and potentially fatal autoimmune condition that causes inflammation of the cartilage throughout the body. Relapsing means it comes and goes, poly means multiple, and chondritis means inflammation of cartilage. It is characterized by recurrent inflammation and destruction of cartilaginous structures such as those found in the ears, nose, and joints. It may also affect connective tissues rich in proteolycans, such as in the eye and blood vessels. It affects around 0.71 people per million individuals each year. Males and females are affected equally. The peak age of onset is 40 to 50, but it can strike at any age. It has mainly been reported in Caucasians, although it can occur in all races. The exact cause of relapsing polychondritis is unknown. It is thought to involve abnormal immune response targeting cartilage components. It's thought to involve both cell-mediated and humoral immune responses with antibodies being produced towards type 2 collagen and metrin 1. These antibodies are found at sites of inflammation such as in the ear, which is mostly made up of elastic cartilage. Recurrent inflammation of cartilage causes damage and even deformity. The inflammation can also affect non-cartilaginous tissue such as those rich in proteolycans, which can be seen in the eyes and blood vessels. The onset of inflammation is often abrupt with the appearance of one or two sites of cartilaginous inflammation such as the ears and the joints. The pattern and severity varies. Systemic symptoms such as fever, fatigue, weight loss are common. Cutaneous features include auricular chondritis and is the most frequent clinical feature. There is redness, swelling, and tenderness of the pinna or ear canal, classically sparing the ear lobes. It is often bilateral. Chronic disease may result in cauliflower ears. Nasal chondritis affects up to 50% of patients and may result in saddle nose deformity. Skin involvement is not very specific and include many things including purpurea, erythema nodosum, or urticaria. Non-cutaneous features include arthralgia, and arthritis can affect both small and large joints. Metacarpophalangeal, proximal interphalangeal, and knee joints are the most commonly affected. Eye involvement is very common and includes scleritis, episcleritis, and conjunctivitis. Involvement of tracheal and bronchial cartilage occurs in affects 20 to 30% of cases and can result in airway collapse, lung infections, and obstructive symptoms such as hoarseness, cough, and shortness of breath. Cardiovascular involvement can result in aortic or mitral valve disease or aortic aneurysms. Renal involvement can result in glomerulonephritis, glomerulosis, associated with poorer prognosis. Nervous system involvement is rare. There might be cranial nerve lesions or aneurysms. Relapsing polychondritis can occur by itself as a primary issue or typically associated with other conditions. Some of these conditions associated with relapsing polychondritis include granulomatosis with polyangiitis, systemic lupus erythematosus, vasculitis, rheumatoid arthritis, Vex's syndrome. Diagnosis is based on recognition of typical clinical features. There are many diagnostic criteria, but the most widely used are the McAdams criteria, and it requires at least 3 of the following clinical features: bilateral auricular chondritis, nasal chondritis, laryngotracheal bronchial chondritis, non-erosive seronegative inflammatory polyarthritis, ocular inflammation, cochlear or vestibular damage. In addition, cartilage biopsy may occasionally be taken to confirm a compatible histological picture. The choice of treatment given depends on severity of symptoms and the extent of disease. In mild cases, non-steroidal anti-inflammatory drugs and oral corticosteroids may be used. Corticosteroids remain the most commonly used therapeutic measure. Methotrexate is often effective. Immunomodulatory agents, such as adalimumab, abatacept, and tocilizumab, have shown promising but mixed result. In severe cases, surgical interventions such as a tracheostomy, nasal septal repair, bronchial segment repair, or cardiac valve replacement may be necessary. It is important to look out and manage complications of relapsing polychondritis such as destruction of the thyroid cartilage, acute upper airway collapse, and obstruction necessitating emergency tracheostomy. Thank you for watching. Please like this video, leave a comment if you have any questions, and subscribe for more informative videos on medical topics.